Type 2 diabetes is a common condition that affects millions of people worldwide. It is a chronic disease that can have a significant impact on a person's quality of life. It affects how the body uses sugar or glucose, which is a crucial source of energy for our cells. Glucose comes from the food we eat and is our main source of energy. When we consume food, our body breaks it down into glucose, which then enters our bloodstream. Insulin is a hormone produced by the pancreas that helps our bodies use glucose by allowing it to enter our cells. In type 2 diabetes, the body doesn't make enough insulin or can't use insulin properly, a condition known as insulin resistance. This means glucose stays in the blood instead of being used for energy, leading to high blood sugar levels. High blood sugar can cause serious health problems, including heart disease, kidney damage, and nerve issues. Type 2 diabetes can develop at any age, and lifestyle factors such as diet and physical activity play a significant role. It is more common in adults but is becoming more common in young people too, largely due to increasing rates of obesity and sedentary lifestyles. There are several things that can increase your risk of developing type 2 diabetes. Understanding these factors can help you make informed decisions about your health. Your genes play a role. If you have a family history of the condition, you are more likely to develop it. This genetic predisposition means that if your parents or siblings have type 2 diabetes, your chances are higher. However, genetics is just one piece of the puzzle. Your lifestyle is also important. The choices you make every day can significantly impact your risk. Being overweight or obese is a major risk factor. What you eat matters. A balanced diet rich in nutrients can help maintain a healthy weight and reduce your risk. Conversely, a diet high in sugary drinks, processed foods, and unhealthy fats can increase your risk. These foods can lead to weight gain and insulin resistance. Lack of physical activity is another risk factor. Regular exercise helps your body use insulin better and can aid in maintaining a healthy weight. Engaging in physical activities like walking, jogging, or cycling can make a big difference. Even small changes in your daily routine can have a positive impact. Regular exercise helps your body use insulin better. By staying active and making healthier food choices, you can significantly lower your risk of developing type 2 diabetes. Type 2 diabetes often develops slowly. You may not have any symptoms at first. Over time, high blood sugar can cause increased thirst, frequent urination, increased hunger, unexplained weight loss, fatigue, blurred vision, slow-healing sores, and frequent infections. If you experience any of these symptoms, see your doctor. Early diagnosis and treatment can help prevent complications. GAP3S. Prevention is better than cure. There are several steps you can take to reduce your risk of developing type 2 diabetes. Maintaining a healthy weight is crucial. Regular physical activity such as walking, cycling, or swimming can help you stay fit. GAP3S. Eating a balanced diet that is low in sugar, unhealthy fats, and processed foods is essential. Focus on whole grains, lean proteins, fruits, and vegetables. Avoid smoking and limit alcohol consumption. GAP3S. Regular checkups with your doctor can help you monitor your health and catch any early signs of diabetes. By making these lifestyle changes, you can significantly reduce your risk of developing type 2 diabetes. GAP3S. Stress management is also important. Activities like meditation, sports, and gardening can help you relax and maintain a healthy lifestyle. Engaging in community health programs and staying informed about diabetes can empower you to make better health choices. Remember, small changes can make a big difference. Celebrate your progress and stay committed to a healthier lifestyle. Living with type 2 diabetes can sometimes lead to complications. It's important to manage these complications effectively. High blood sugar levels can damage your blood vessels, leading to heart disease, stroke, and kidney problems. Regular monitoring of your blood sugar levels and taking your medications as prescribed can help prevent these issues. Foot care is also crucial, as diabetes can cause nerve damage and poor circulation in your feet. Check your feet daily for any cuts, blisters, or sores, and see your doctor if you notice any problems. Eye care is important too, as diabetes can lead to vision problems. Have regular eye exams to catch any issues early. By managing your diabetes effectively, you can reduce the risk of complications and live a healthier life. Managing type 2 diabetes can be challenging, but you don't have to do it alone. There are many resources and support systems available to help you. Diabetes education programs can provide you with valuable information and skills to manage your condition. These programs often cover essential topics like meal planning, physical activity, and monitoring your blood sugar levels. Support groups, both in-person and online, can connect you with others who are going through similar experiences. Sharing your journey with others can provide emotional support and practical advice. These groups can be a source of encouragement and motivation, helping you stay on track with your diabetes management plan. Your healthcare team, including your doctor, dietitian, and diabetes educator, can offer guidance and support tailored to your needs. Regular check-ins with your healthcare team can help you adjust your treatment plan as needed and address any concerns you may have. There are also many apps and tools available to help you track your blood sugar levels, diet, and exercise. These digital resources can make it easier to stay organized and manage your diabetes effectively. Some apps even offer reminders for medication and tips for healthy living. By utilizing these resources, you can better manage your diabetes and improve your quality of life. Remember, you are not alone in this journey. With the right support and tools, you can take control of your health and thrive with type 2 diabetes. The good news is that type 2 diabetes can be managed. With the right approach, you can lead a fulfilling and active life. Medications can help control your blood sugar levels. These medications work best when combined with other healthy habits. Your doctor might prescribe tablets or injections. It's important to follow their advice and attend regular checkups. Lifestyle changes are crucial. Losing weight can make a big difference. Even a small reduction in weight can improve your blood sugar levels and overall health. Even a small amount of weight loss can help. Regular exercise is essential. It boosts your mood and energy levels. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This can include activities you enjoy. Brisk walking, swimming, and cycling are all good options. Find what works best for you and make it a part of your routine. A healthy diet is vital. Eating well can help you manage your diabetes and improve your overall health. Choose foods that are low in sugar, unhealthy fats, and processed carbohydrates. Fresh, whole foods are the best choice. Focus on fruits, vegetables, lean proteins, and whole grains. These foods provide essential nutrients and help keep your blood sugar stable. Managing type 2 diabetes requires effort, but it is possible to live a long and healthy life with the condition. With the right support and habits, you can thrive.